Well, tonight, a potential return to normal for local children. Parents hear from educators and public health experts about the risks and benefits of opening Oregon schools. It is 10 o'clock. Good evening, everyone. I'm Jeff Giannola.
And I'm Elizabeth Din. Thanks for joining us tonight. So local educators and health experts just got together for a webinar hosted by OHSU, addressing some of the most important questions about how to keep students and teachers safe.
And Jenny Young was listening in on that webinar. And Jenny, what were some of the big takeaways did you think tonight as you listened to that?
Jeff, Elizabeth, this went on for about 2 hours. It just wrapped up about an hour and a half ago. There were a lot of questions coming in from the community, but one of the biggest takeaways is coming from the director of education here in Oregon and an OHSU doctor saying that the data is now showing that schools are not major spreaders of coronavirus.
Our kindergartners are 5 years old, so think about 5, 6, and 7-year-olds attempting to connect with a teacher in a class online and learning to read. And I know our teachers are working incredibly hard.
Colt Gill, the director of the Oregon Department of Education, was one of 5 panelists speaking virtually to families across the state Wednesday night, addressing how those families and their children have been impacted by remote schooling and how the state can reopen safely.
Our message, nationwide has really been that it's not yet safe to go to school. Now we're learning that it is, and we need to make sure that folks understand that and understand the reasons why.
Gill talked about how research is now showing schools are not super spreaders. He referenced a new CDC report on a study done in schools in Mississippi.
Basically saying that schools are not super spreader locations, that they are very safe, structured locations, and may be safer for our students and staff members to be there for 6 to 8 hours a day than other places in the community.
KOIN 6 has heard from parents and caregivers worried about their child's mental health as schools remain closed. Dr. B. Alex Foster, assistant professor and pediatrician at OHSU, says the stress from the pandemic is going to remain with students for a long time.
While adults have coping mechanisms, children, and we know this from both abusive situations, but also from other natural disasters, they biologically embed that stress in their bodies.
He went on to say the mental health problems he and other doctors are seeing in young patients are more intense than other years, and some out of the ordinary.
It's incredibly sad of cases of children sort of just giving up and stopping eating. They don't have a body image disorder, like in terms of what you typically think about anorexia. They've just stopped eating.
Lake Oswego Superintendent Dr. Laura Cruz was also part of the panel. She says she's far more concerned about the well-being gap for students than the academic one.
I just cannot emphasize enough that we are going to have to approach this through a healing-centered lens and a trauma-informed lens that is not only for our students, but for our adults as well.
Now, as we have reported, Governor Brown is calling lawmakers into a one-day special session on Monday where they're expected to vote on COVID-19 liability protection for schools, something that educator leaders say is essential if schools are to reopen. Reporting live tonight, Jenny Young, KOIN 6 News.
Jenny, thank you. It's not